Women make up 70% of the healthcare workforce, but only 20% of its leadership. On Her Story, we'll explore the careers of bold and influential women from Silicon Valley to Capitol Hill and learn how they've overcome the odds. This is Her Story, a program where we explore what's beyond the glass ceiling.
Hey, it's Ceci. We're back with Her Story, and I have such a terrific guest with us today. This is Dr. Lisa Simpson. She is president and CEO of AcademyHealth, which we're going to hear a little bit about today, and a dear friend of mine, fellow woman of impact. Lisa, welcome to Her Story.
Oh, Ceci, it's a real pleasure to join you.
Terrific. Well, we like to start most of these Her Story conversations, Lisa, with a little bit of your story. In particular, you are a physician. You now run a big powerhouse organization based here in Washington, D.C. Tell us a little bit about your journey. Were you focused on medicine from childhood? How'd you get on this path?
Some people have intentional and planned out career journeys, and that is not my story. So my story definitely has a unifying thread, but it is more a story and a journey of serendipity and hard work. And so I come from a non-medical family. My father was a U.S. diplomat. I grew up overseas. But what my parents really instilled in us, both my mother was a stay-at-home, work-at-home mother, and my dad was the importance of women having choices in their lives. This especially was important since I'm one of 4 girls. And so as I was good in the sciences, I ended up choosing medicine, not because I thought I wanted to be a doctor, but more that I knew that if I were a physician, I could then choose to go into research, go into clinical practice, potentially move into more leadership roles. But I saw it as a way to have opportunity as a woman.
Fantastic. And I love a father figure who really believes in the success of women and daughters. And I know that's the case with all of your sisters. Tell us a little bit more. So you make it through medical school, which is no small achievement. And I am curious, when you went through medical school, residency, et cetera, were there many women role models, peers? What was that like for you in the early days?
So I went to medical school in Ireland because our family home was in Ireland. And I like to say I would not be a physician today because I could not have afforded medical school in America. In Ireland, as an Irish resident, it was affordable. And so it was heavily subsidized by the state. And actually, we did have quite a few women in our class. So there were peers. In terms of role models, no. Most of our professors, except our anatomy professor, were men. So didn't see much there. And, it took me a while of reflection over the years to look back on my experiences in terms of, was I treated differently as a woman? Did I have barriers put up in front of me or opportunities provided because of my gender? And I have one anecdote that I always remember when I asked my chemistry professor for a reference for a summer job. I still have this letter. It was handwritten, and the sentence that stands out for me is, Miss Simpson is a diminutive damsel of most attractive appearance. Now, what the heck? What has that got to do with my skills, my intelligence? But it was 1976. So a very different world. So I think that I was probably not as aware at the time of all the ways that my presence as a woman really did affect my experience throughout my training. And so I went from medical school to pediatrics to public health. And as I like to say now, I think I'm misquoting Kierkegaard about life is lived forward, but understood backwards. What I see as a constant thread in my journey as a woman and as a leader is this dissatisfaction or impatience with the status quo of there's got to be a better way to do this. And the way I chose to try to answer that question was through research, by helping to either create better evidence about what works in healthcare to make communities and individuals healthier, or to help support that research or promote that research. And so through my journey in the public sector, the private sector, I landed in the nonprofit sector here in Washington at AcademyHealth, where our mission is to improve health and healthcare for all. And how? By advancing evidence into policy and practice. So in a way, I couldn't think of a better role or organization to be in as really a culmination of all that I've learned and continue to learn in my work every day.
So we focus a lot here at Her Story on leadership, and in particular, women leaders, how they got there, advice, etc. And you have this such a diverse background and range of experience, as you say, government, private sector, now at a nonprofit in DC. And I'm curious if there are different elements of your leadership style that you think have come from those, or that have, you've pulled together where you are now. What did that eclectic background do for you?
It's a great question. And I don't know how much of it is unique to me, as opposed to as we learn and grow older, some of the lessons that come along the way. So I've already mentioned sort of my impatience for change, and I'm also a pretty fast thinker. And one of the things I had to learn about my presence and my style was to step back a little bit, and to not always be the first one to speak, to not cut people off, and to really actively listen. And then what I was able to bring as I developed that skill was, because of my background growing up in so many different countries, I think it's enabled me to work sort of cross-sectorally and across different cultures, organizational or various cultures, to really kind of understand the importance of these different perspectives, and to honor and make room for all of them. So that's one area I've seen myself evolve and change. I think the other aspect is I've also learned to understand the power of my words. So when you're a CEO, Ceci, you know this, if you have an idea, well, you've got to really signal to your staff, is this an idea I expect you to act on and I want you to do this? Or am I brainstorming here? Is this an idea I want us to bat around and figure out if it makes sense? And so that importance of being very clear, depending on the audience and the context of the conversation, helping folks with signposts about what your expectations are for action on their part.
Boy, that is spot on. I can really relate to that. And so how do you try to navigate that, here's a crazy idea that popped into my head versus, no, I really want this to happen now. How do you approach that with staffs or coalitions or stakeholders or whoever you're working with?
So I think what I have found and continue to learn from is the importance of building relationships with individuals, so that your reputation almost precedes you. When you enter the room, people have heard of your organization or of you. And so that takes time and effort. And the importance of building trust. And so that when you are clear and signal, I would like this to happen, people know, oh, she's serious. Or you signal, okay, I'm not sure about this. Let's hit this around. Let's bat this idea around. When you're doing that with your team and your staff or your collaborators, if they've worked with you before, if you have laid the groundwork for trust, it's going to be a lot easier for people to push back, to tell you, that's kind of a harebrained idea or a great idea, but not right now. How about this alternative? So I think that's been part of my strategy as I go forward. So really building on those relationships, nurturing them, and really stepping back, okay, if there's more than one way to accomplish the goal, it doesn't always have to be my way. And so letting other people lead, I think that's been important too.
obviously you are a great success these days, but I bet there were setbacks along the way, barriers, hurdles. Talk a little bit about, and in particular, were any of those because you were a woman in a position or the only woman in a setting? Were those challenges for you to navigate?
So I remember back when I like to say my first real job after my residencies was as the maternal and child health director for the state of Hawaii. And as such, I oversaw a series of categorical programs in perinatal health and family planning, and I could go on, but to improve the health of moms and kids in Hawaii. And I found that the way I'd like to characterize it is that sometimes it felt like the real decisions were being made in rooms where only the big boys were. And for me, the question was, how do I get access to that room? And so it contributed to my decision to leave that position and eventually go back and get a postdoctoral fellowship in health services research and health policy, because I felt I really hadn't, my MPH was in epidemiology, so I did not understand health policy making in America, the various actors and stakeholders, and how to navigate and leverage those and be effective. And so I think gender certainly played a part of that, but otherwise, I would say because of my background as a pediatrician in maternal and child health and working in children's hospitals or in government, in my field, those are actually disciplines and sectors where women are pretty well represented, as opposed to, say, consumer tech or some other aspect of the healthcare ecosystem. I mean, in our membership at Academy Health, we have over 50% women members. And at our conferences, our annual research meeting, when we come together, about 3,000 of us, we have about 50-60% women. And importantly, we have about 50% women presenting. So it's not just women in the audience, it's women on the stage as well. And so I think I perhaps have not experienced quite as many gender-based barriers given the sectors I work in, but they're there.
Absolutely. And, that I think that's a great example. I mean, I know that you are extremely intentional and purposeful about the speakers that you put on a national stage, women, people of color, et cetera. That doesn't happen accidentally. Has it been challenging? And what are your other strategies for helping now other women and different groups come along and succeed with you?
Yeah, absolutely. This is as you noted, this is a big priority for Academy Health and for us, and really to bring new voices into our community. And I want to make clear, they're new to us. They have been out there. We have just not engaged or reached out or acknowledged them. And so part of a number of different strategies we're using. One is, a lot of our field, about 50% of our membership is in academic settings. And that's a pretty traditional, pretty hierarchical, title-based sort of community and approach. And so what we're doing is we're reaching to earlier career individuals who, just by nature of the demographics in America, are more diverse by race, by ethnicity, by gender identity, sexual orientation. So that's one strategy. Another one is then actively making opportunities available. We have increased our mentoring programs, our scholarship programs, and our most recent initiative, we will announce our new cohort next month, but we are working with the Op-Ed project which is a project which is really founded, I'm sure you're familiar with them, Ceci, given your background, to bring the underrepresented voices into writing op-eds, because those articles are dominated by male and white voices. And so we launched this initiative back in August. We received over 90 applications for just 20 slots. And having just finished reviewing them, an amazing cadre of excellent researchers from all walks of life and all areas of the country. That's the other thing, is that in our field, in evidence and policymaking, we're pretty bi-coastal sort of community dominated by the coast. And so another strategy is proactively reaching out to everybody else to get institutions and states who have not been heard from as much in our gatherings and in our community, but who have so much to contribute.
Fantastic. I am super excited about that one in particular. You mentioned mentorship, and we are always very interested at Her Story in any experiences that you've had with terrific mentors, or maybe not, and then how you think about that now as a senior executive.
So absolutely. I'd like to say I've probably learned a little bit the hard way of the value of mentors, because I think that until I had a mentor, and I'll touch on that a little bit more, during my postdoctoral program, and so I'd already done 2 residencies, medical school, a real job, all that, I'd never had a mentor. I had nobody to turn to for advice. As I mentioned, my family's not in healthcare. Nobody took me under their wing. So it wasn't until my early 30s that I experienced the power of a mentor. And one of a few things I've learned about mentorship. One is you don't rely on just one mentor. There are different mentors who will help you with different aspects of your career development and advancement. And that it's not just mentorship, it's also sponsorship. It's actively not just listening to having somebody to turn to and ask questions and they give you advice or help you find your way. It's that person then actively connecting you, helping you build your network, introducing you to the right rooms. And I think I always turn as one example of a mentor who helped me during my postdoc and after that was Dr. Philip Lee, who founded the Institute for Health Policy Studies in California, San Francisco, where I did my postdoc. And he connected me to people. He pushed me to, meet with Barbara Starfield, a luminary in our field at Hopkins. And she and I ended up co-authoring an article together in JAMA. I never thought I would get to work with Barbara Starfield. So that sort of active mentoring and sponsorship is critical. The other mentor I had gave me the advice I most hated and was best for me. Okay, so I did not want to hear this when John Eisenberg said, I was deputy director at ARC, and John told me, you need to focus, what gets the fire in your belly going? And I was like, well, child health. I'm a pediatrician. I'm passionate about improving children's health and their outcomes. And he said, okay, you're the deputy. You have all these management responsibilities, and you need to become known in child health services research. I'm like, and during which hours of the day? Excuse me. So it took a lot of work, but he was absolutely correct. I started publishing more in child health, giving more speeches, and it really helped me, secure my jobs and advance my career. Because in our field, it really does help to be known in one area.
That's such terrific advice. I am curious at the beginning, I think you alluded to this a little bit, but one of the questions we really like to ask our guests is this notion of, would you describe yourself as an intentional or an accidental leader?
Mm-hmm. I say both. So I alluded at the beginning to my career being sort of a series of serendipitous events. And so that's where the accidental part comes in. But it takes a lot of hard work to be ready for that opportunity, to be able to jump at it and benefit from that accidental or unexpected event. And so that's the accidental part. But where the intentionality comes in is always being sort of driven by some, whether you call it your North Star or your fundamental values. And that for me, as I said earlier, is about, impatience with the status quo and a belief that through knowledge, we can figure out a better way to achieve health and equity. And the other sort of fundamental value that I'd like to mention is that of kindness, of doing one's work in a way that is generous, Our field and our world can be very cutthroat if we let it be. And I think, if you put it sounds a little corny, but if you put it out there, you will get it back. And so that kindness is really important as I do my work.
No, I like that. I like that a lot. Another question, the Her Story folks would phrase it as, is there a particular characteristic or trait that gives you the edge? Sue Turney and I refer to it as, what's your superpower? Have you got one, more than one?
So I would say that my superpower is probably optimistic energy. I've been called the Energizer Bunny. I've been called all kinds of names. And they probably have something to do with the fact that I'm also petite, that old diminutive damsel I mentioned early on. But I am at heart an optimist. And I have to say that the last 3 pandemic years have challenged all of us in maintaining that hope and optimism. But that is what I think allows me to lead our staff through these difficult times, to always come back to the aspects of hope in our work, and then follow that up with the energy to execute and follow through. So optimistic energy.
I do like that. And it's interesting how many CEOs I talk to, men or women, that say to me, I'm an optimist, and I think to be a leader, you need to be an optimist. And, to your point about the last several years with the pandemic and so many challenges. And I'm often struck talking to CEOs, and they can go through the whole litany of challenges, but at the end, it's always like, but, I'm excited about this, and this is going to happen. It's a remarkable skill. What sort of advice might you offer to our listeners, in particular, so many, I think, younger and mid-career women in healthcare thinking about moving up, maybe into those leadership ranks? A good tip or two for them?
So I think for me, what has been essential is to build and nurture my network back. And I started doing that with Phil Lee during my postdoc, and then maintaining those connections. So whether it's a mentorship relationship or a peer relationship, you have to nurture that over the years. You have to both give and seek and stay in touch. And it's amazing to me how many people I am still in touch with. And Ceci, on the point of the networks and the connections, I mean, the Women of Impact Network, our other group that we're both in, that support from peers throughout your career has been really essential. And so I think building that network and nurturing it over time is essential. I think the other piece of advice, and, it's, we all come at this from very different ways, but I think it's also to really learn to be comfortable in your own skin, so to speak. That's kind of an adage, but to be self-reflective and always self-assessing. And I think, again, referring to the last 3 pandemic years and how our country has been really trying to grapple more effectively with racial injustice and the needs for change in our healthcare and policy. That ability to continue to commit to learning about yourself and being on a journey of learning and authenticity, I think I wish I'd started on that younger. That self-reflection and that self-assessment is just essential to constant learning and improvement.
I love it. Well, as expected, this time has flown by. I just have to say, I would never think of you as a diminutive damsel. I might think of you as a giant. But we are so grateful to Dr. Lisa Simpson for joining us today. Lisa, thanks a bunch.
Oh, great to be here.